We are back with you now on Wave Listens Live with Freedom Mini Dental Implants. We have Dr. Regan Ackerman joining us here today to talk all about how this could be something that could help you. Great to see you as always.
Thank you. You too.
Let's talk a bit about mini dental implants, because if folks haven't heard about this before, aren't familiar, they might want to know what the main difference is between these and some of the procedures that they have heard about.
Definitely. It's one of the biggest questions I get. So the big difference with the mini dental implant, the reason we say mini is just because it's a smaller diameter, less invasive, less healing time, less costly than the more surgical conventional implant. So, you know, a lot of people that are struggling with dentures, I can use these mini implants to snap their denture on or replace missing teeth. But the healing time's a lot less, and I don't have to do any incisions or stitches. I don't have to put people to sleep. My patients drive themselves to the office, can drive themselves home. A lot of them go to work the next day. So it's a lot less invasive. It's just a one-piece titanium implant that's a smaller diameter than the more surgical traditional implant. And I don't have to have as much bone to place a mini dental implant. So people that were told that they may not have been a candidate for the bigger surgical implants could definitely be a candidate for the mini dental implants.
You have dedicated your practice to these mini dental implants. Would you say that one of the reasons why is because the success rate is so high?
Definitely, yes. And to give people another option. Like, so many people need this option. Like you said, this is all I do all day, every day, is place the mini dental implants. So I've placed well over 2,000 of these mini implants. So they're very successful. I have patients that have had them for 10+ years, and also, like I said, it gives people an option that maybe thought they didn't have an option because they were either told they weren't a candidate for the surgical implants, maybe they couldn't afford the surgical implants, or maybe the process was just too much, because sometimes the surgical implants, it can be a year-long process sometimes. So this process can be, you know, a lot shorter with a lot less healing time.
One of the best ways to showcase that is with the models that you brought, the one in the back specifically,
yes,
showing the difference in the pilot hole.
Yes, definitely. So this, I think, speaks volumes on kind of the biggest difference in the mini dental implant. So when I place the mini dental implant, like I said, I don't have to have as much bone. So I'm not making this big hole. I'm going to cover that up so that you might even be able to see the pilot hole that I make because it's so small. But all I do is numb you up, you know, local anesthetic, don't put you to sleep, and make this little pilot hole through the gum into the bone. So I don't have to make an incision. I'm not placing stitches. People that are on blood thinners, a lot of times I don't even have to take you off a blood thinner. And then it's a one-piece, just smaller diameter implant that screws and torques into the bone. So a lot less invasive than these big surgical ones. So I think this model really shows how I don't have to have as much bone to place a mini dental implant. So people that were told they weren't a candidate, didn't have enough bone for these big surgical ones, or maybe just didn't want to go through that process because it is a bigger, longer process. Definitely look into the mini dental implants. We do free consultations. It includes a 3D x-ray. So please call and see, you know, I'll take that 3D x-ray, make sure you do have enough bone for the mini dental implant, and we'll, you know, make sure you're a candidate and go over your options and costs.
You've got some other models here that show if you are a candidate that there are different options depending on what your needs may be.
Yeah, definitely. I'll kind of start with this one because I know we've talked a lot about, you know, dentures and whatnot, but say you're just missing one tooth. A lot of people have a partial or what they call a flipper, had an old sports injury to replace a tooth. And if you have one, you know what I'm talking about because you're miserable and you hate it. It flops, it comes out. So I can place the mini dental implant and you leave with a temporary that day. You get rid of the partial that day and come back about 4 or 5 weeks later and get the permanent tooth that I'm gonna submit on to that implant, and you get rid of that partial. So instead of placing an implant, the big surgical ones, and waiting 6 months to a year, within a month you can have a tooth permanently cemented onto your implant. Doesn't have to be just one tooth. It could be 2 or 3 teeth. A lot of people are missing their molars in the back and want something to chew with. place the mini implants, no, less invasive, no stitches, and then, we cement the crown or the bridge, depending on how many teeth you're missing. They get cemented on and stay on those implants permanently. So you no longer have a partial or a flipper that comes in and out, or if you were just missing those teeth, now you have something to chew with or smile with.
We know we've got about 2 minutes left. I want to make sure that we can show a before and after here, because these really tell the story as well as anything, and the smiles on the folks' faces, it's always wonderful to see.
It can be life-changing. Oh, this is one of my favorites. This is Chad. Talk about life-changing. So he came to me unable to wear dentures, was embarrassed. That's why he had the big beard, trying to cover up his smile. So we did snap-in dentures for him. So I placed mini dental implants. The day I placed the implants, he left with his dentures snapped on to those implants. And now he's able to wear his dentures because they're not moving and flopping. He doesn't have to use glue. And I mean, just look, and he shaved his beard off because he's not trying to hide
totally
his
different
smile
person.
or anything. Totally different person. Like, looks years younger too. And just, a great person with a great personality that was hiding behind that beard because, he was embarrassed because he didn't have teeth and he couldn't tolerate a denture, and he didn't think he had any options, and we were able to give him an affordable option with the snap-in dentures, and now he can keep his dentures in comfortably.
If folks are watching today and they think, gosh, that was me, whether it's with a beard or something else, I've been hiding my smile, I've been putting off this call, or I've been told there's nothing that can be done, and now I'm thinking, well, maybe there is. How do we go about setting up a consultation, and what does that look like?
Definitely. So the most information you can find is at freedomimplants.com. But there's our phone number. It's 937-4930. Call the office, just schedule the free consultation. I'm the only dentist there, so you'll see me. We'll take a 3D x-ray to make sure you do have enough bone and you're a candidate. I'll go over your options, the treatment plan, any financing if we need to look at that, and then ultimately it's your decision, if you think this is the right thing for you. So please call and make the appointment for a free consultation.
All right, Dr. Ackerman, it's always good to see you.
You too.
Thanks for coming in.
Thank you.
We'll see you back here soon.
Yes.
All right, stay with us here on Wave Listens Live. We have got much more to come after this short break.
Right now, West Shore Home is helping to make your dream bath a reality with our 3 for Free sales event. Every week, we help hundreds of homeowners reimagine their space, and now we're making it easier than ever with free installation, interest-free financing.